Welcome, students, to this educational explainer. Today, we're tackling something that is absolutely crucial, one of the most complex, challenging, and, let's be honest, emotionally taxing aspects of dementia care. We're talking about wandering. If you're learning how to care for someone experiencing cognitive decline, you already know that keeping them safe requires a really delicate balance. It takes profound empathy, but also a highly structured approach. So our goal for this course today is to give you a very concrete framework for understanding the why behind wandering, and then equip you with the practical, actionable tools you'll need to manage it effectively. Okay, let's dive into this. To really understand wandering, we have to start by grounding our lesson in the emotional reality of the patient. I want you to just imagine this for a second. You're standing in the very living room where your loved one has safely lived for years. Suddenly, they look toward the front door and desperately plead, "I want to go home, the kids need me." It's a completely heartbreaking scenario, right? Physically, they're perfectly safe. But mentally? Mentally, they are trying to leave a house they already live in so they can fulfill a deeply felt obligation. Understanding that massive disconnect is really the foundation of our entire lesson today. To make sure you walk away with real, actionable strategies, we're going to follow a clear educational framework. Today we'll cover 1. The reality of wandering. 2. Uncovering the hidden triggers. 3. Immediate caregiver response steps. 4. Proactive home modifications. And 5. Addressing unmet physical needs.
All right, let's jump right into Section 1, the reality of wandering.
When a wandering event begins, as a caregiver, you are instantly thrust into a high-stress situation. And usually we rely on our natural instincts, right? But the problem is, those instincts are often flawed. Look at this comparison. Over on the left, we see that totally natural caregiver reaction. Stop, you are home, you can't go out. Well, this fails. Why? Because it creates an immediate communication breakdown. You're essentially trying to enforce logic that the patient's brain literally can no longer process, so it just turns into a frustrating argument. Now look at the right side. This is the effective approach. Let's give your son a call. This works wonders because it validates their emotional reality. In this case, their genuine concern for their family, instead of fighting against it. And that validation is what allows you to gently redirect them.
Moving right along to Section 2, uncovering the hidden triggers.
Now, to truly master that redirection we just talked about, we have to understand what's actually causing the behavior in the first place. Now, what's really interesting about this slide is how it fundamentally shifts how we view the patient's behavior. Listen, wandering is not an act of defiance, not at all. It is a profound communication of distress. See, when a patient loses the ability to verbally explain where they're going or why they want to go there, they act on it physically. They might be reliving an old memory where they had to go pick up their kids from school. Or they might simply look around and genuinely not recognize the living room they've sat in for a decade.
But it's not just internal psychology going on here, it's external too. Just picture your own entryway for a second. Everyday visual cues are incredibly powerful. A prominent front door, a purse resting on a table, keys casually tossed in a bowl, or coats hanging in plain sight. For a patient with progressing dementia, seeing these normal objects can inadvertently and instantly plant an uncontrollable urge to leave. Literally, the environment itself is signaling to their brain that it's time to go.
Let's get into Section 3, immediate caregiver response steps. So what exactly do you do when they are actively heading for the door? Well, this right here is your crucial emergency protocol. First, approach them in a calm, reassuring tone of voice. Do not yell, and definitely don't aggressively block them physically. Just ask them gently where they're going or who they're looking for. Second, reassure them they are home, but do this by pointing out familiar things in their environment to kind of ground them. And third, and this is key, the second you have their attention, distract them immediately with a new, pleasant activity. This helps them completely forget that initial urge to wander. Getting the pacing of these 3 steps right is absolutely vital for your success.
To see what this actually looks like in action, let's look at a specific scenario from our source material. So, a father insists on leaving because, quote, "the kids need me." Now, his daughter, Jane, she doesn't just say, "you live here." Instead, she points out a familiar object. She says, "See, here's a family picture. I'm right here, Dad. I'm Jane, and Tom, your son, is just 5 minutes away." Then, boom, she deploys the immediate distraction. Let's go give him a call on the phone and say hello. It's brilliant. It validates, it grounds them, and it immediately provides a pleasant alternative activity.
Which brings us to Section 4, proactive home modifications.
Of course, the absolute best way to handle a wandering event is to prevent it from even starting, right?
And we can do that with physical environmental changes. The very first strategy is to visually eliminate the primary escape route from the patient's awareness altogether. You can actually disguise the exit door, paint it the exact same color as the surrounding wall so it just blends right in. Or you can cover it entirely with a large poster or a picture mural. You can easily buy these online. The logic here is simple. If it doesn't look like a door, the brain simply doesn't register it as an exit.
Building on that exact same idea, we also have to hide the physical mechanisms of the door. Because look, even if the door is painted, a shiny brass doorknob, that's a dead giveaway. Covering the doorknob with a simple little drape neatly conceals the hardware. I know it sounds incredibly simple, but keeping your visual environment strictly neutral is a highly effective trick.
And this brilliantly illustrates how we can actually use the visual perception changes associated with dementia to our advantage. It's called the black doormat tactic. By simply placing a black doormat totally flat on the floor in front of the exit door, you create a visual barrier. Because of the way dementia changes depth perception and visual processing, many patients will look at that dark square and actually perceive it as a physical drop-off or like an impassable hole in the floor. So, they'll naturally avoid crossing it. You're literally using the disease's own symptoms as a protective tool.
To wrap up these physical home modifications, we need to look at environmental deterrence. Putting authoritative signs on doors, things like stop, do not enter, or keep out, can actually be super successful at discouraging them from leaving. And crucially, circling back to those external triggers we mentioned earlier, never ever leave coats, hats, or keys in plain sight or resting by the front door. Just remove those triggers completely from the living space.
Now for our final module, Section 5, Addressing Unmet Physical Needs.
As a final reminder for this course, good dementia care really requires looking at the whole person. Sometimes, wandering isn't psychological at all. It's a purely physical response. When that sudden urge to wander strikes, caregivers need to put on their detective hats. Is the patient experiencing physical discomfort? Or maybe stress? Because they lose the ability to articulate exactly what is wrong, you have to be very specific in your questioning. Actually, scratch that. Don't just ask, "Are you okay?" Ask specifically, "Would you like a sandwich?" Or "Would you like some coffee?" Or "Do you need to use the bathroom?" Oftentimes, wandering is quite literally just a search for food, water, or basic physical relief.
Another frequently overlooked physical need is just plain old unspent energy. If your loved one isn't getting enough daily exercise, well, that physical energy doesn't just magically disappear. It builds up inside them and can easily manifest as this unbearable, restless urge to just get up, wander, and walk. Ensuring they get sufficient daily activity can dramatically reduce pacing and wandering behaviors overall. Now, before we conclude our lesson today, I want you to really take this next thought to heart. Wandering can still happen even if you're the most diligent of caregivers. I really want to completely remove any stigma or guilt you might be feeling about this. If your loved one wanders, it is a symptom of a progressing disease. It is absolutely not a failure of your care. You are doing a profound, incredibly difficult job, and all these tools we've discussed today, they're here to support you, not to judge you.
I'd like to leave you with one final provocative thought to take with you as you finish this explainer. If we understand that wandering is ultimately just a search for comfort, safety, or resolution, I ask you, what is your home communicating to them? I challenge you moving forward to walk through your house and view your care environment entirely through the patient's eyes. Are your keys saying, "Let's leave"? Or is your environment whispering, "You are safe, you are exactly where you belong"?